Hello, I'm Matt Jennings, lecturer in drama at Ulster University in Northern Ireland, and we're here to introduce some puppetry techniques we've been using with medical mannequins as a way to help teach nursing students and drama students person-centered care, or person-centered practice, or person-centered nursing, depending on which terminology you're using. We've been working using drama techniques to help people think about paying attention to how another person feels and how you interact with them. We've also recently been incorporating puppetry work with the wonderful Karen Torley from Banyan Puppet Theatre, who has been teaching the nursing students basic puppetry skills in order to animate the medical mannequins that they already use for medical simulation training and assessment, in order to try and encourage nurses who might get used to treating a patient as an object, if they're used to using medical mannequins for practicing treatments and procedures, to start practicing on the mannequin treating the object like a human being, or humanizing the object. So Karen Torley is going to explain the 4 basic principles of breath, belief, focus, and touch that we've been introducing to nursing students as a way to animate a mannequin for interaction with other nursing students in medical training role play scenarios.
I'm Karen from Banyan Theatre Company. This is PJ Quinn, this is Shay and Holly. And what we're going to do today is look at animating this medical mannequin. First of all, they're very, very heavy. We've been working with nursing students, trying to get them to put a little bit of life into these mannequins so the students can feel more empathy. So we've got Shay here, who we're going to... Shay, are you quite comfortable at the moment in your position? So we're going to look at different principles, which are breath, belief, focus, and touch. So first of all, we have to believe in the mannequin, in the puppet that's here. It has to become a person for us, so we have to inject energy into it. So opposed to thinking it's just an object which we're just going to move around and dollywaggle, as the term comes up, we're actually going to put some energy into it. So you have to form a belief and a connection to the character PJ Quinn to begin with. And once we've got that, we're going to look at his breath. Now, the breath is not something you're going to take and try and do a movement. You're going to take it from your own breathing. So if you find your own breath and have some tension in your arm, and the breath is going to come from you. So he's going to actually take on your breath. So it's very important to get a good grip on the puppet, because these are so weighty. They're obviously made to be used for a puppet. So Shay, if you can make sure your hand is really firmly up inside and hold it against the back of the hairline of the puppet is the easiest, and tuck your elbow into him a little bit, then you'll find more of a connection between yourself and the puppet. So if we have the breath going again. And Shay, if you make sure your focus doesn't deviate at all away from the puppet, so no matter what's going on around you, you always focus on the mannequin. And the focus isn't just the puppeteer focusing on the puppet, it's also the puppet focusing on what he's looking at or what he's engaging with. So the focus is a two-way thing. The touch is very important. So we've got the hold, but the touch is very important. So Shay, if you want to bring your hand, and get a good connection with the puppet. The weight is actually leading us, and we can bend and manipulate the hand and the arm, but we're actually using the weight of the puppet. Once we've got those basic principles with it, then we can start to respond to things that are happening around him. So he can look around the room. So if I was talking, he could respond to me, and the same goes for Holly. They're much more difficult to work than conventional puppets, because obviously they've not been made in a way that you can actually manipulate in an easy way.
Hi, I'm Carl. I'm a PhD researcher who's recently started working with Matt on the project with nursing students at Ulster University in Northern Ireland. I'm going to explain to you how we've built the scenarios for the nursing students to engage with alongside the puppetry and Peter Quinn here with Karen Torley. So we came up with scenarios for these mannequins to become patients. So PJ was a motorcyclist before he had an accident and became paraplegic. Hi, PJ. PJ, nice to meet you. I'm Carl. I'm the new district nurse coming in to assess your needs today. How you doing? Doing well? Good. Hi, I don't know you. Carl, I'm the district nurse.
Hi, I'm Holly. I'm PJ's sister.
Oh, nice to meet you. Really nice to meet you. So how's your sister doing at the moment? Is she looking after you all right? Yeah?
Yeah.
Yeah?
Yeah.
And how's PJ been? Has he been in good spirits?
Lately, he's been a bit off.
Right.
He's just not been himself.
PJ, is that right? Have you not been feeling quite yourself recently? Is it something to do with your diabetes, maybe? Yeah. Yeah. Is it a problem taking it, remembering to take it? Is it? Yeah.
I try and give him as much independence as possible. It's
Sure.
just he's been having a bit of trouble ever since the accident, and it's just almost as if he doesn't care anymore. It's hard to see him like this.
Sure.
But it's
Well-
just if you could help.
Oh, of course, I'm really sorry, PJ. I'm really sorry to hear that that's been happening. I'm really glad that we can talk about it now. Maybe we can talk about possibly getting some of your friends over, because I'm sure you feel quite lonely at the moment with the. Yeah, you'd like that. You'd really like to see some of your friends. Do you feel like you've been a bit isolated, maybe? Well, that's okay, PJ. What we're going to do is we'll get a schedule for your insulin for you to help administer that for yourself on a good schedule, so it's taking some of the pressure away from you. Do you think that would help?
Would that make him feel better?
Well, hopefully, because a lot of it is linked to burnout and forgetting to take the insulin and the medication, and that can lead to feeling like you are at the moment, I think, PJ. And I think really getting some of your friends in to see yourself and annoy your sister will probably help you a little bit. Yeah.
Nice to see you back to your old self and driving me up the wall.
That's a rough example of the scenarios that we would run with the nursing students as part of their assessment. And these scenarios are trying to explore their communication skills. And that includes something called sympathetic presence, which involves listening, paying attention, and responding to the patient.